lots of texts from patients lately and emails from patients about illness and whether or not they need antibiotics. So here is what I generally say. There are a few different things that I will use antibiotics for. Number one, strep throat. So that's just sore throat, swollen lymph nodes, and usually there's no new nasal congestion, sneezing, and no cough. So that's something that we would be able to do a rapid strep for, and that's something that we would use antibiotics to treat. The next thing would be pneumonia. So coughing, especially, often coughing up some gunk, some fevers, chills, body aches, pneumonia. That's something that we would use to treat, use some antibiotics to treat. And generally speaking, with pneumonia, it's a lung infection. There's usually not sore throat, nasal congestion, that kind of thing going on. And then the last thing is a bacterial sinus infection. And so that's an infection of the sinuses and the sinuses next to the nose or in the forehead, nasal congestion, sneezing, sometimes voice change. You can lose your sense of smell or taste sometimes, tooth pain, fevers, chills, and going on for more than 7 days. So it's an infection that's going on 7 to 10 days, and that will typically mean, okay, this is a bacterial infection that needs antibiotics. Most sinus infections are viral. So the vast majority of sinus infections don't need antibiotics, but if it's lasting 7 to 10 days, then that's when I would probably pull the trigger and say, it's going to be worth it to take antibiotics at this point. All of the other colds that are going around, lots of sore throat, cough that could be dry, cough that could be bringing up some gunk, facial pain, sneezing, voices changing, people are losing their voice. So many viruses going around that really don't need antibiotics.